All right, everybody, welcome. We are having a YouTube chat here about Ebola. I'm Troy Hayden, work with Fox 10 News, and I'm joined by two local experts here in the Phoenix area. Rebecca Sunenshine, an infectious disease specialist with the Maricopa County Health Department. Thank you for being here, Rebecca. And Robin Schaeffer, you're a nurse, but you're also the executive director for the Arizona Nurses Association.
Correct.
Now, we thought it was important to bring both of you in today because there's a lot of talk about this disease. I think there's a lot of fear. And the first question I'll put to you then is this fear, is this concern warranted about Ebola here in the U.S.?
Ebola is one of those diseases that for some reason causes so much more fear relative to the amount of risk that there is. And it's important for people to know that as long as the disease is in Africa, there is some risk. But right now, the risk to the general public, to anyone who's not taking care of someone with Ebola, is still very, very low.
So, and we'll get to exactly how you can catch it in just a second. From your perspective, I've heard a lot of nurses are not very thrilled about the prospect of treating Ebola patients right now. Why is that?
I think they might be a little fearful because of the two nurses that contracted Ebola.
Right.
But being a nurse and a frontline caregiver, I'm always dedicated to the patient, so that I want to be sure that if I was working in an institution where there was an Ebola patient, that I was given the right personal protective equipment, and that I was sure that that would protect me.
And we'll talk more about what happened at that Dallas hospital in a little bit, but let's get to what I think is the main question that most people have. How do I catch Ebola? And you're saying the risk is low, and we keep hearing that a lot from the CDC, from the White House. Why is it so low? How do we catch it?
Ebola is spread when someone has broken skin or contact with blood or body fluids to their eyes, nose, mouth, or broken skin. So it really isn't casual contact, like sitting next to somebody or just talking to them or working with them, that can cause Ebola. You really have to have extensive contact with someone else's body fluids who has Ebola in order to get it. Okay,
well, let's talk about a few scenarios if we can. You're talking bodily fluids. I'm on an airplane, say, with somebody who has symptoms, and then you have to have symptoms to be contagious, correct?
That is correct.
Okay, so somebody's sitting next to me, they think they just have a regular fever, they have Ebola. They sneeze, okay, on that tray table, they sneeze in the air, and on the armrest, I put my hand down, there are droplets of mucus there, and then I wipe my eyes.
I'm gonna
we'll go
to the doctor for that.
So, in theory, that could transmit Ebola, but we've never ever identified a case that way.
Okay.
So you have to understand that there's sort of, if you set that up in a laboratory, we could probably make it happen, but people aren't getting Ebola that way. When they looked at the thousands of cases in West Africa, more than 95% of them, and that's about the amount we have data on, either cared for somebody who was sick with Ebola, so had lots of blood and body fluids and vomit all over, or they actually took care of somebody who had died of Ebola. That is the risk. Sitting next to someone on a plane is considered very, very, very low risk.
Okay, so when you talk about somebody dying from Ebola, so it's more the amount of the bodily fluids that they're dealing with, because, and you're saying, is blood worse than a sneeze? Is diarrhea or vomit worse than a tear?
Absolutely. So they have done lots of studies on levels of virus in different body fluids. And I think that's part of the thing that's scaring everyone. There has been a small amount of virus identified in sweat and tears, but there's much, much more virus in blood, and the vomit and the stool, which are often bloody, can also have quite a bit of virus in it. So it depends on what type of body fluid it is and how sick the person is, where they are in the stage of infection. And what we're seeing is that the highest risk is when people are at the end of their disease, when they have a lot of fluid loss from different places on their body. That's when you're most likely to be exposed.
So it sounds like the people most at risk are the people in your industry, nurses, doctors,
Exactly.
orderlies, people who are dealing with that sort of thing. And there was some talk about what happened in Dallas, and maybe they didn't have the correct protocol or the correct. What are your thoughts on that? And are we prepared here in Phoenix?
My initial thoughts, and they're still my thoughts, is that it could have happened anywhere and gone down exactly the same way, because it was the first patient that we had, the index patient that we referred to, and we weren't even though we think we're prepared, there are procedures and policies and protocols for isolation and different levels and different protective equipment that you wear. When you have a patient that actually has the full-blown case of Ebola, which we weren't prepared for, I don't know that any of us would have done it any differently. And that includes wearing all the protective gear.
But what
that we
about,
wear.
I mean, there obviously were some mistakes at that Dallas hospital
Yes.
with sending that patient home originally. Maybe the worst mistake.
Yeah, that's very concerning.
Right. Does it surprise you that nobody in the index patient or patient 0, the first person who died here, that nobody in his household has contracted this yet?
Thank you for pointing that
Yeah,
out.
that's a good
no,
question.
it doesn't surprise me.
Doesn't
and
surprise
I
me either.
want I want everyone to know that and understand that these are not just people who he sat next to on a plane. These are his family members who lived with him, and they did not get Ebola. So it tells you what level of contact you need to have with someone when they're very, very sick in order to spread it. Can I point something else about
Absolutely.
the
That's what we're here
Dallas
for.
hospital
Okay.
and about Emory? And this is not the Dallas hospital's fault, but I think it's a lesson learned that our hospitals can really, really take away from this experience. Emory, before they got their 2 cases, they had 3 days notice. And you know what they did in those 3 days? They drilled on infection control and how to put on their gowns and their gloves and how to take them off without contaminating themselves. And they drilled it over and over and over. Dallas didn't have that luxury. They didn't have the time before they got the patient to practice and to drill, and that is the lesson learned for our hospitals.
I would agree.
Are you seeing that drilling going
Yes.
on here? What's being done?
I have reached out to many of my colleagues who are infection control and prevention nurses in various hospitals, and I hear the same story from all of them. They are doing drills, they're reviewing protocol, they're practicing with actually fake body fluids, you know, getting the equipment off. And now a lot of them have instituted the recommendation from the CDC and the World Health Organization to have the buddy system, where you're watching each other
okay,
for
sure.
breaches.
So you think you're doing pretty well? We're doing pretty well
Yeah,
at this
I
point,
know
as well
that
as we
all
can.
of my nursing colleagues that are working in hospitals right now are in the infection control area and the administrative area are exhausted
Right.
from getting the word out and spreading the information to all of the direct healthcare providers.
All right. So let's get back to the rest of us who aren't in the health field. Should there be a travel ban? Should visas being given to people from Liberia, say, or Nigeria, or West Africa? In your thoughts?
Absolutely not. I think the worst thing that we can do is further isolate this country, make it harder to get in and out of the country. What those countries need are supplies, they need personal protective equipment, and they need people to help do that contact tracing, get people into treatment facilities so that they're not spreading it to their family members at home. And we need to help them curb the outbreak. But trying to just sort of lock them in and hope that things go well, it's not going to go well for any of us, and it's just going to spread throughout Africa.
Well, but theoretically, we could still charter planes and get people over there. What I'm asking is it a good idea to allow people like this index patient who apparently didn't tell the truth on a form that he was caring for somebody who died of Ebola? Do you think it's a good idea to keep people from that country coming over here? I'm not saying don't send supplies over there, people to help, but keep them from coming here.
I think that's difficult to do. And you know, I agree that it would be so hard to control something like that. And the outcome wouldn't be as beneficial as you think it might be.
Does it concern you that we're sending service members over there possibly who maybe they're not doing this drilling that you're talking about? Are we sending people over there, young men and women, that may not know exactly what they're doing and putting them in danger?
Well, I would say if we're sending our service men and women over there, that they are prepared and that they are doing drills. And I think it's lesson learned that we haven't heard of anybody that we've sent over there contracting Ebola.
But the doctors, correct? The doctors
Well,
are over there.
that was
Right.
prior to, you know, sending all the relief people over there. The doctor contracted it, and from what I've heard, it's that he did have some casual contact with a family member who might have touched the dying patient. I mean, I don't know the whole story, but can anyone else confirm that that he actually hugged one of the family members after the patient had died.
I don't know about that right now.
I'm not sure.
And
Let me ask you this, and this is something that other people have pointed out. Are there other diseases that we deal with on a daily basis that are more dangerous than Ebola?
Also a great question.
yes, that is a good question.
So when we look at a disease just by itself without looking at the situation, we look at something called the R0, and that just means when one person gets infected, how many people on average get infected from one person. And the number that we look at for Ebola is for every one person, on average, 2 people get infected. When you look at mumps, a vaccine preventable disease, that number is 8 to 10 people. When you look at measles, that number is 18 people. So this is a less infectious virus than a lot of other viruses out there from a scientific standpoint.
What about like the flu that's going around that we get a vaccine for every year? I know the strains change.
The strains change. I think, you know, obviously people are much more at risk to contract the flu than they are of Ebola, and everybody should consider getting a flu shot this season.
I think the scary thing, though, is that when we throw out there that 70% of the people who get Ebola don't survive. That's the latest number I saw.
Right.
It's scary.
It's very scary, and it's very scary. So I'm in the U.S. Public Health Service. We're the people who are being deployed over there. A lot of my friends and the people I work with are going over there. I do want to point out that they are very well trained. They are going to courses on personal protective equipment. They're highly trained before they're even allowing them in the country.
So this is not like some Air National Guard 19-year-old airman.
No, these are, even if it is a 19-year-old airman, they are going through the most strict training on personal protective equipment, and they're only being allowed near patients if they have been highly trained and given all the proper equipment.
If I can change gears just for a second here, we dealt with a little first grader who just passed away earlier this week from what we're calling a mysterious, we just don't know what the virus is yet, and there's been speculation it's the enterovirus. So people are a little obviously upset about that as well. As a parent, and you have a child who's sick, how do you know there's a difference between a child who's just sick with the flu and who may have the enterovirus? Is there any way you can tell?
So
At
I am
home?
a mom
Okay.
of a 6-year-old with asthma, and I'm a trained physician, and I will tell you that it is really difficult, even for me, who's trained in infectious diseases. So I don't want to make it sound easy, but what I've been telling parents is, if you have a child who has a fever and achiness and flu-like symptoms, what you want to watch for is making sure they can take in enough liquids and that they're not having any difficulty breathing or their lips turning blue. But if any of those things happen, you want to get them right to a healthcare provider. And that child who died, it hit all of us so hard. It was tragic. But that is a situation where the child had difficulty breathing and there just wasn't much time really to get the child cared for. And I think the important lesson learned is to know that if there's any difficulty breathing, you've got to get your child to a healthcare provider.
Last word here. Are you overly concerned that we'll see a major outbreak of Ebola here in the U.S.?
I am not.
Are you?
I do not think there will be significant spread. We may have a few more cases, but I don't think there'll be a lot of spread.
Yeah.
Well, thank you both so much for coming in here. I think this is really enlightening, and thank you so much for watching.
Thank you.
Thank you.
It was really nice work.